Good day, viewers. Diabetes affects 11% of the population in the United States, with 28 million individuals diagnosed and another 9 million people unaware they have it. Diabetes affects many aspects of your body, including your skin. Bad skin is frequently an indication of extremely high blood sugar levels. In today's video, we'll talk about diabetes warning signs that appear on your skin. 1. Colored patches. Any strange color on your skin is frightening, especially when it appears out of nowhere. For people with diabetes, this is a daily reality. Have you noticed yellow, red, or brown patches on your skin? These patches are caused by a condition called necrobiosis lipoitica, which is almost exclusively found among diabetics, according to experts. The skin around these patches may seem glossy, like porcelain, and blood vessels may be visible. At this stage, your skin will be itching. Just make sure you don't scratch it. This will just exacerbate the situation. This skin disease frequently alternates between active and dormant states. 2. Skin tags. No, we're not referring to the snagged tag on your shirt. These are very different. Skin tags are mostly innocuous, but they're nonetheless unsightly. They occur as a result of your skin tissues expanding, and they're most commonly found on skin folds, the neck, and armpits. Skin tags are normally non-cancerous, however, they can be uncomfortable. Insulin resistance has been linked to various skin tags on the body, according to a study. There are a few over-the-counter medications that can assist with this, but it's advisable to go to your doctor, especially if the skin tags continue to develop in extreme situations. You'll have to undergo a procedure to remove skin tags. 3. Blisters. Blisters are another indicator that you should be on the lookout for. You'll notice them right away. They're generally large blisters that might be one large blister or a cluster of them. Either way, they'll be large and painful. You'll normally find these blisters on your hands and feet, but they can also emerge on your legs and forearms. They're uncommon, but when they do occur, the blisters typically differ from one another. These blisters are not to be confused with those caused by allergic responses or fungal infections. Blisters produced by diabetes are normally painless, and they don't usually leave scars. If you detect these blisters on your skin, see a doctor as soon as possible. 4. Dark patches. Have you ever noticed dark velvety skin patches on your armpit, neck, or groin? If so, it's time to start paying attention to your health. Dark velvety skin patches are usually a sign that your diabetes is out of control, which means there's too much insulin in your blood. Dark velvety skin patches can also be itchy, but don't scratch them. It may also smell. A little darkening of the skin in the creases of your neck is usually the first time you have. It's easy for your doctor to diagnose after a thorough examination, but if they're going to treat the disease, it's a different story. They'll need to see if they have diabetes or are insulin resistant. 5. Extremely dry itchy skin. Diabetes patients generally have dry skin. It's enough to make you grimace simply touching it. This form of the skin develops as a result of excessive blood sugar levels that are out of control, resulting in impaired circulation and rough skin. The best strategy to address this is to first control your diabetes. Please don't imagine that putting topical medicines in the dry places would solve the problem. You'll require therapy. Dermatologists will be able to inform you what sort of therapy you need and how to deal with the spots very fast. Of course, you'll need to get your diabetes checked out. 6. The skin becomes thicker. It's possible that the skin on your fingers and toes has stiffened. If left untreated for too long, digital sclerosis can make the backs of your hands look waxy and tight, and your fingers will become so stiff that they will be difficult to move. If left untreated for too long, digital sclerosis can make your fingertips feel like they have pebbles in them, and the hardness will spread to other parts of your body. It can start in your upper arms and forearms, then spread to your neck, shoulders, and upper back. It's uncommon for the skin on your knees, elbows, and ankles to thicken, but it might happen if you haven't managed your diabetes for long enough. As a result, straightening your leg, bending your arm, or pointing your foot will be tough. The thickening of your skin will generally be followed by an orange-like texture, so what should you do? What should you do if this starts to happen to you? Make an appointment with a doctor to discuss a treatment plan. You must regain control of your diabetes. Physical treatment will also be recommended by your doctor to ensure that you do not lose joint mobility. 7. Skin infections. Skin infections are more common in people with diabetes, and they may be easily diagnosed by hot, swollen skin that is too painful to touch. You might also get an itching rash or small blisters. Another telltale sign is dry, scaly skin. Infected skin may also flow out a white discharge. Diabetes may cause skin infections everywhere on the body, but they're most common under the nails or between the toes. You might even have an infection on your scalp, which is alarming. Make sure you get this treated as soon as possible since skin infections spread quickly. 8. Open sores and wounds. Diabetes makes healing tough for your body. This is due to the fact that if blood sugar levels remain high for an extended period of time, they might disrupt your circulation. Diabetes can also harm your nerves. The longer you wait to treat diabetes, the worse it will be for your nerves. Poor blood circulation makes it difficult for your body to repair wounds adequately. This is why diabetics with uncontrolled blood sugar frequently get foot ulcers. You'll notice redness and strange swelling on your feet, and if you don't treat the ulcers immediately, they'll spread to other parts of your body, making them much more difficult to cure. If you have diabetes, make sure to inspect your feet every day to see if there are any cuts or shin spots. 9. Shin spots. As the name implies, it mainly affects your shins, and you'll see spots and even lines on them. People with long-term diabetes are more likely to develop shin spots. Diabetic dermopathy is the name for this skin disorder. Shin spots are normally brown in color and fade away around the 2-year mark. As for how long they last, you never know. Your doctor will be able to identify shin spots based on their size and form. It's essential to have your diabetes checked if you're experiencing shin spots. Blisters produced by diabetes are normally painless, and they don't usually leave scars. If you detect these blisters on your skin, see a doctor as soon as possible. 10. Rough, yellowish spots on your eyelids. Embarrassing, itchy areas on and around your eyelids should never be overlooked. This is especially true if they're yellow in hue, as they might be caused by xanthelasma, a skin ailment. Xanthelasma can affect anybody, although diabetics are at a significantly higher risk. If you're on medication and still have yellow scaly areas around your eyes, your blood sugar levels should be tested. This is an indication that your diabetes isn't being properly managed, and you should speak with your doctor about the best method to handle these patches. While it's typically a mild condition, it's important to address it as soon as possible to prevent making it worse. The warning signals that emerge on your skin aren't the only symptoms of diabetes. There are a few more that you should be aware of once you've been diagnosed. Once you've been diagnosed with diabetes, you'll need to pay special attention to your food. If you know any other signs of diabetes we haven't discussed in this video, please share your thoughts in the comments box below. We'd love to hear from you. If you like the video, give it a thumbs up and share it with our friends. For more tips and secrets, subscribe to the channel. 2 videos have been handpicked for you to watch. Go ahead, click one. Or better yet, watch both, and learn more about how your body works.